this is Colleen and I'm going to talk about the Cephalopelvic Disproportion or CPD. So CPD is a situation in which a fetal head fails to descend for the maternal pelvis, causing the arrest of labor. Though it is rare, cephalopelvic disproportion occurs when a baby's head or body is too large to enter or pass through the canal. CPD accounts for one of the reasons why a woman's labor fails to progress to delivery, making a normal vaginal delivery difficult or nearly impossible to complete. Shorter women and adolescents are more likely to suffer from CPD. The American College of Nurse Midwives estimates that CPD occurs 1 out of 250 pregnancies. And the diagnosis of this does not mean that you will have the same problem with subsequent deliveries. So a study published by American Journal of Public Health holds that more than 65% of women with a previous diagnosis of CPD in earlier pregnancies were able to deliver vaginally in subsequent deliveries. So the possible causes of this or the cephalopelvic disproportion includes the macrosomia. So this implies that the baby is abnormally large. This condition may be due to abnormally high maternal sugar levels from gestational diabetes or diabetes mellitus. Hereditary factors is post-maturity when a pregnancy extends the due date, and also if the shape of the pelvis is too small or malformed. Also, abnormal fetal position. This small pelvis is very common in shorter women and heights of 150 centimeters and shorter. So a previous case of pelvis disease or trauma may also increase the probability of a small pelvis. Possible symptoms of this is prolonged labor. CPD may cause a situation where labor does not progress. Also a large fundal height. This is the distance from the mother's pelvic bone to the top of the mother's uterus. This is the measure of the size of the uterus and can be used to assess if the child suffers from macrosomia. A higher volume of amniotic fluid. So as we all know, amniotic fluid is a clear, slightly yellowish fluid that surrounds and protects the baby while in the uterus. A higher than normal volume of this may indicate that the child is abnormally large. So for the diagnosis of CPD is phlebometry to evaluate the baby's position in the womb, the tissue surrounding of the mother and her baby, and the size of the pelvis. So ultrasound is used to examine the shape and size of the child's head. If the diagnosis suggests a case of CPD, a doctor will examine a woman for various risk factors such as testing her blood glucose to check for gestational diabetes and other risk factors associated with this condition. To monitor the well-being and abnormally large baby, the doctor may also conduct the non-stress testing. For the treatment, if CPD has been confirmed and if vaginal birth is not possible, the doctor will order a cesarean section or C-section. But if vaginal delivery is possible and the C-section would be harmful to a child, the mother may be asked to change her position. Okay, so she may have a squat or assume another upright position because this can increase the pelvic capacity by 30%. A child's head might get stuck also in a birth canal due to CPD. And in order to free that, the doctor may have to cut the woman's pubic bone in a process called symphysiotomy. So this is done during a vaginal birth. After safe delivery, the child should be assessed for birth injuries and low blood sugars. As the child gets older, the child also should be checked for CPD-related complications such as insulin resistance or obesity. I think that will be all. Thanks for watching.